Hi, my name's Philip Knopp. I did a critique on a very lengthy titled article. It's called The Use of Computerized Tests to Evaluate Psychomotor Performance in Children with Specific Learning Disabilities in Comparison to Normal Children. Um, it was done in India. Authors are Department of Clinical Pharmacology and Pediatrics, Seth GS Medical College, and KEM Hospital out of Mumbai, India. I'm not familiar with any of them, but that is who did this research project. Um, what they were trying to do is to show that children with learning disabilities, whether it be learning mathematics, efficiency in reading or writing, and do tests, which they call psychomotor performance tests, on a computer to show that kids with those specific learning disabilities would perform at a worse rate than children without specific learning disabilities. So they tried to control for factors such as their socioeconomic status, age. They wanted to make both groups fairly equal. It does only include 25 students on both sides of the test, so their control group consisted of students who were normal or above average academically. That might skew things a little bit automatically, in the fact that they include some above average children, but they were from ages 7 to 14. And they do go over in the results about the average age, and basically they were between 10 and 11 years old on average. There's not a big significant difference. The one I do question a little bit is the ratio of females to males, and sometimes people might say, well, there's more likely to have a male with a disability than a female. Whether that's true or not is not. I don't know for sure. I know I've heard that before, but there was a 3-to-2 male to female ratio in the specific learning disability group, whereas it was a 1 male to 2 female group in the control group. So I wouldn't necessarily consider that completely controlled for, but maybe there were some outside factors that made them decide to do that I am unaware of. So basically, they controlled these two groups. They tried to keep them, other factors outside the fact that one had a learning disability as consistent across both groups as possible. So they even ruled out the control group whether a person would have a disorder, ADHD, something else that would influence theirs. So they want to basically keep the normal, as I guess most people would call them, normal students versus people with learning disabilities only. So they excluded people with vision or hearing problems as well. So the tests, I'll just kind of go over them briefly. There was a finger tapping test. It's basically how many times they could hit the enter button in 20 seconds, and it recorded that information. And the second test was a simple reaction test. It took 60 seconds. There would be a picture of a boy on the screen, and every time they saw the picture, they were supposed to select whether that it was a boy, and they recorded basically the time it took them, the reaction time it took them to hit the button. There's two tests that they don't really give a description of what it was, just tells you what they tested. That is the choice reaction test and the choice discrimination test. So I really have no idea how that test was really administered, and I can't really give you any information on it. There's a digit picture substitution test. And it does go into some detail. I'm a little confused because it's somewhat of a short description. Basically, it displayed 1 to 9 digits and then had a picture that associated with those digits as well. And they were timed on their reaction speed on how quickly they did their task. The last one was a card sorting test because they were given 52 cards. I don't know whether this is like a standard playing deck or not, but they were told to sort them based on numbers and symbols. So, and they timed that as well. So they were given, before these tests, they were given 3 training sessions throughout a week that were 20 to 30 minutes, and then they were given these tests on the computer. They found that there was a significant difference, and by that they were using a standard t-test to compare the results for both groups, and they actually did give it a nice detailed chart on the information from their tests, and they did show that 2 of them were not significantly different, and that was the simple reaction time and the choice discrimination test. They didn't, at least maybe the sample size was bigger, they might have found a difference, but even though the averages were different, that's not significantly different enough to make a conclusion like that. But on all the rest of the tests, they showed that people with learning disabilities did perform at a lower capacity than those of the normal students. I was a little disappointed, when I decided on this article to critique, because I was hoping it would, I guess, be a little more complex of a test, or maybe something more informative to learn. However, I am really hoping, as I put in my critique, that this was maybe a test done to show that there was a reason to do further testing, because in his conclusion, he states, further research is needed to evaluate the remedial education plan the results in performance and psychomotor performance of children with specific learning disability on the selected tests. So I'm hoping that he's basically saying, yes, I've shown you there's a significant difference between their ability. Now I want to research that whether we're able to teach them effectively with what we're doing now. So I'm hoping that's what his goal was, or the author's goals were, because it looks like there were actually 5 people involved. That was their goal, I hope, when they did this research. Thanks.